So the impact that COVID-19 has caused for oncology, pediatric oncology care has been significant, and mainly because of the unknown in terms of therapies and the concern of asymptomatic patients admitted to our units, and the potential for immunocompromised patients getting really sick. So we prepare in our institution as well as other institutions in the country to try to prevent as much as we can, transmission inside of our hospital. So by way of adjusting schedules in outpatients and procedures, and obviously the ones that are on active treatment cannot, be delayed. So we're trying to kind of make some modifications based on that to decrease the spread. So our institution particularly treats, and as many institutions in the United States treat patients through the Children's Oncology Group Consortium. So there actually came up pretty early on with some general information for patients and their families in terms of, there were a lot of questions in the beginning, how at risk they were just because they were immunocompromised, and the need for, not interrupting their treatments. So COG came up with a very nice letter explaining how, the spread, the more frequently described symptoms, and in general some reassurance and what to do, who to call, when to call. In general, most pediatric oncology patients and families are fully aware that fevers is a significant symptom that they always have to call us for, which is a very common symptom in COVID-19. So it's been a very nervous time for the family, but they're also prepared for that because we do a lot of teaching up front when they're first diagnosed in terms of what are symptoms that are of concern that they need to call us and let us know. But they're being overall better as we give them more information. I would say, depending on the child's age, most of the younger kids, do have some impact in terms of changing their lifestyle, which is true also in a way. By the time they get diagnosed with cancer, that is an immediate change on their lifetime. The same for the family. Families in general are already stressed from their child having to get this treatment for cancer. So obviously, this added an extra, layer of stress, if you will, just because not knowing and knowing that the mortality is high, not only in the States but outside. So they're obviously very concerned. They're the most vigilant, if you will. If you see people outside being careless and going out, our oncology families are not. But they're very stressed. Obviously, we have to talk to them every time we see them in the hospital and in the clinics. They're very concerned about the impact with the expected reactions of stress, lack of sleep, and fearful and kind of. We have some family support groups for some of the adolescents. Adolescents are also another group of the actual patients that have a lot of anxiety related to all of this. Kind of, they're very fearful and anxious and concerned of the future, what's going to happen in the future. But again, we have some support groups for the teenagers and some for the parents of children with cancer.